Start by thanking Miguel and Brad and everyone at Board 2 and Board 4 and everyone else who has been part of the coalition working on the community health needs assessment, and thank Judy and everyone else who is here tonight. You know, we're in a place where none of us wanted to be almost a year ago without the hospital in Greenwich Village, and I think we all can list numerous times when ourselves or friends or family have personally felt what that means not to have that hospital there and having to race to another hospital or worry if the fever doesn't break, how quickly can I get to the emergency room, or just not to have the folks in our neighborhood who are our friends and neighbors who work there for so long, and small businesses can tell you what it's like now around there, and it isn't a good situation at all. We've obviously had new developments today as it relates to what's been filed with the bankruptcy court. The plans obviously will unfold, and I think we'll hear some more tonight about them. I think Brad got it right. Obviously, our long-term goal is we want a full-service hospital back for this neighborhood. This plan, we have to also recognize that's not going to happen immediately. And we need to understand what this plan is and whether it meets what the community has articulated in the community health assessment that we need. Having this document is going to be very helpful in guiding us as we continue to move forward as it relates to the plan that's out there and as it relates to our long-term goal of getting a hospital back in this neighborhood. Now, Judy can tell us better than anybody. We're swimming against the tide here because there's other neighborhoods whose hospitals are now on the chopping block because of the Medicaid reform and other cuts in Albany. But that doesn't matter. We know what we need. We know what our long-term goal is. We're going to look at the plan through the lens of the short-term goals that the health survey is really going to help us focus on. So I just want to thank, on such a miserable night, so many people coming out tonight to help us keep our efforts moving forward. So just thank you all, and I just want to recognize Melanie LaRocca, my district chief of staff, and our Board 2 liaison, who has been our point person on the community health survey. I'm running off to two other things, but they're going to stay for the rest of the meeting. So thank you guys very much, and thank you for spending so much time tonight.
Thanks, Chris. We're going to move now to a discussion of the community health assessment. Then we're going to discuss North Shore Long Island Jewish proposal. So we're going to do the assessment first, discussion, then we're going to have North Shore Long Island Jewish, and then we're going to have a period where people can ask questions or make comments about anything they heard tonight. Does that sound good?
We represent the Coalition for a New Village Hospital. We're the largest group in the area working on this issue.
To me, this is utterly deceitful, shoddy attempt to deceive the people in the community who live down here and ignore all of the things we've been saying. And to call this an emergency room, it's like me calling my car an ambulance. It's utterly absurd. What was that?
You called it out as a lie during the meeting.
It's a typical deceptive use of language to try to get people to believe something that's not true. It is not an emergency room, at least not by any law or regulation in this state and any clinical practice that I've been involved in for 35 years.
So for those who don't know, doctor, what is the definition of an emergency room in your opinion?
It's a facility that is part of a full-service hospital where there's the backup to take care of all medical and surgical problems as they arise on an emergent basis, particularly those that are totally time critical, like strokes, heart attacks, perforated organs, stab wounds, gunshot wounds, overdoses, etc.
What did you think of this meeting?
I actually thought the meeting was, initially I was totally disgusted with it, but I kind of got more into questioning. I wish there were 5,000 people here, and I think it's insulting that not a single elected official was here for the meeting.
And what did you think when you heard the news this morning when you were coming?
I wasn't surprised at all. This deal has been in the making. It was all a question of when they'd finally announce it. I think it's been a done deal for 6 months or more.
What do you think is the appropriate response from the community at this time?
Appropriate response to the community?
Yeah.
I think we keep doing things like tonight, and we get out in the streets, and we fight it, and we talk to our elected officials, and fight it, and do everything possible.
Anything else you want to add?
No, I'm very discouraged. I think this is just so deceitful and deceptive and virtually an immoral process. Very discouraging.
The most valuable thing we have right now is the community. The community. It's always been the community. I don't know how we get the politicians to listen to the community because the politicians don't even show up at these things. The politicians haven't shown up for a year now. They haven't been at any rallies. They send their underlings to come. They don't show up at all. So the value of tonight, it is very interesting comments made from the people of the community that were here, which were a lot of different faces than I've seen at other rallies and other meetings. It's the community. They have to come out. The nurses have to come out. The doctors have to come out, especially when people are making comments about the care that you would get in an emergency room versus the care in a full-service hospital. It's like, I think David said, that's like calling my car an ambulance, which is a really kind of interesting concept. It's still the community, so I ask the community, please don't give up on this fight because it has to pass many state agencies before it finally gets done. I know it's been going on behind closed doors. I knew about this last week. When I went to bankruptcy court, I was told about it. And now we have electeds standing up here saying this is the first time they heard about it was this afternoon. Okay? We're being lied to on every level, and we need to get to the truth. The community is the only one that can demand the truth, and please don't give up, because I'm not giving up.
I think that the proposal that came out today is, in simplest terms, real estate interests and financial interests deciding healthcare policy. And that can't be what happens for our community. And that's the bad news. The good news is that today the community was very clear. We've been saying the same thing we've been saying for a year. An urgent care center, a comprehensive care center, whatever you want to call it, is not a hospital. And I think people made very eloquent, very sophisticated, and very intelligent reasons for why we need a hospital. The quality of care, the type of people who are going to be offering that care, the quality and the training of those people, the level of care, the types of care, you know, it's apples and oranges. And as I said, the community has an absolute right to health care and to public safety, and we're not going to stop until we get a hospital back at the site of St. Vincent's. The other thing I want to point out is that the good news of this is that the Rudin Development Corporation and Long Island Jewish Hospital are talking about health care. That's wonderful, and what they told us was they're willing to spend in their money $110 million aggregate to do that. They've also mentioned that St. Vincent's, which I thought was already a dissolved entity, I'm not sure how they're at play in this, but St. Vincent's Hospital is willing to donate the land, which is upwards of worth hundreds of millions of dollars as well. Now, we heard last month from an engineer from ARUP who said that the general cost of restoring a hospital at the Coleman building would be maybe $200, maybe $300 million at the top. That's the same amount of money that we're talking about in terms of getting this comprehensive care center. So what that means very clearly to me is that there's a way to do this. Again, if we have a hospital, we're talking about thousands of people's jobs, not the 400 that they're talking about, which is 8% of the population of employees who are at the St. Vincent's campus. 8%, that is not going to re-stimulate or revive the economy that's suffering in that area. But more importantly, a hospital is going to give us the quality of care that we need and that we deserve for the community, that is in the ballpark of dollars that we're talking about. So if we're able to get this comprehensive care center, we would be able to use the same amount of money, same donation of property to rehabilitate and adaptively reuse the Coleman facility and actually have a hospital. Furthermore, once that hospital is there, we'll be able to bring in federal revenue streams that wouldn't be available to us for a comprehensive or urgent care center. So the good news is the community is absolutely on board with a clear message that the hospital needs to be restored there, that it can be restored. It is now up to our elected officials, our public servants. This is a defining moment in this struggle as I stand here 10 months into this exhaustive struggle for a hospital. This is an opportunity for our elected officials officials to say to the Rudin Development Corporation, to LIJ, thank you for being interested in having a discussion about healthcare, and we need to go back to the drawing board, and we need to make this work in a way that actually protects the healthcare needs of the community. This is the moment for our elected officials to do just that. They cannot yield to the powerful interests of real estate and of other influential financial interests. They must be the representatives for the people, and this is their moment in history as we stand here today. I hope that this is just a trial balloon, and I hope that in a couple of weeks or months we will see a new plan, and we want to be able to have a seat at the table as well. The Coalition for a New Village Hospital is 6,000 members strong. We have been trying to meet with the Rudins, we've been trying to meet with LIJ, we've been trying to meet with the elected officials. We are reasonable people. We are just in the state that we're in because we are in a health crisis, and we cannot afford to lose necessary health care for our people.
Well, I was going to ask you, have you reached out to the Rudin family?
We have several times, and now is a very pivotal time, as I said. When I made a public plea tonight to please meet with us, that we want to be sitting down with them, and we believe that there's a reasonable solution here that takes into account their interests, but also preserves and cares for our community.
And what did you think about the meeting tonight?
You know, like I said, I was very disappointed that there weren't elected officials here. I understand that Speaker Quinn was here for a very short time. I wasn't able to be here when she was, but there were no elected officials here for the overall duration of the meeting, and that's unfortunate. But the good news is the community we are a smart and intelligent community, and we weren't fooled, and people understood very clearly that when they tried to talk about being able to treat a heart attack or a stroke, that's absolutely not what's going to be available at a facility like this.
Okay, last thing. You mentioned something that's going to be happening, the coalition is arranged.
Very important. Now more than ever, we need to get out on April 30th for a one-year anniversary rally that the coalition, in conjunction with 50 other community organizations, is organizing. If we don't show up in mass, they'll be able to do these deals. We need to move these deals from out of the back rooms and into the streets and into the public transparency that we deserve, and it's the only way that's going to make this actually happen in a way that's fair and usable for our community. So April 30th, please get out and join us. Tell your friends, get involved. If you would like to be a sponsor of the event on April 30th, please go to www.demandahospital.blogspot.com and send us an email. Let us know that you'd like to become a sponsor, and please get the message out April 30th.